What is Olivia's role at Enhanced Dental?
So I've been at Enhanced Dental for the last 6 years in total. Initially it was mainly just sort of general dentistry that I did, but quite quickly I decided to go into more sort of cosmetic restorative. So usually my role is just doing all the sort of smile makeovers really in the practice. Say if a patient comes in and they do need a little bit of like health work, so some fillings. Often I do that sort of treatment just because I like to sort of take control of the whole patient journey. Generally it's just smile makeovers.
What are Olivia's qualifications and experience?
So I often get lots of comments basically saying that I look quite young to do what I do. Ever since sort of qualifying from Birmingham University, I always knew that I wanted to get into more sort of cosmetic dentistry. I've done lots and lots of different courses, spent lots of hours studying. It's something that they don't teach you in dental school. You have to go out of your way to find these courses. I've also had a lot of other dentists message me on Instagram asking for tips and sort of how I actually do my composite techniques. This led me to create my own online course. So dentists can actually pay and learn my sort of tips and tricks, things that I've sort of picked up over the last sort of few years. I've also won awards at the Private Dentistry Awards and the Clinical Case Awards, and more recently started doing a few online lectures. So those are for big companies like Dental Update, and also recently started doing some more like face-to-face lecturing at conferences and things around the UK.
Why did Olivia want a career in dentistry?
So a bit of a funny story, but basically when I was a kid I always used to say if there's ever a job that I'll never ever do, it's be a dentist. But part of that reason was because my sister was always really scared of going to the dentist. I was always really nervous as well. She'd had some bad experiences, so yeah, it was something that wasn't really the top of my list. But when I went into sixth form, we did some of those quizzes where, I don't know, they talk about your strengths and your weaknesses, and dentistry kept coming up as like the number one. So I had a little look into it. It basically said that it was like a bit of a mix between sort of arts and science, and those are the two things that I did at A level. So it was a bit of a gamble, but I ended up going for dentistry in the end, and it's definitely paid off.
What advice would Olivia give to other dental professionals?
So top tips for other young dentists are, first of all, make sure that you invest in like a really good quality camera, and do this just even from your training year when you're first out of university. Main reason is because you want to be taking really good quality pictures of your work so you can see what you want to improve. Also invest in a good set of loupes. So those are obviously almost like the little magnifying glasses that we wear. It means that you can see those teeth sort of 5 times closer than what you can with your normal eyes. And that's really, really important just for reflecting on your work, continuously trying to improve things. And then final tip is just, I had a lot of feedback when I was a young dentist, maybe older dentists that were maybe more NHS based, saying, you know, why are you doing all these extra courses? You need to build up your experience first in sort of NHS dentistry. But I mean, you go to university, you learn all like the best gold standard protocols for certain procedures, what materials to use, and then you get into NHS dentistry and actually you can't use all those materials. So I would say ignore the people that say, you know, you need to spend 5 years in the NHS first, and actually invest in yourself, go on those extra courses and try and upskill as much as possible.
What cosmetic dental treatments does Olivia offer?
So I offer pretty much all the different types of cosmetic dental treatments, so whether that's something as simple as a bit of whitening, also do composite bonding. We do lots of teeth straightening as well, usually using a clear aligner system, so Invisalign. Sometimes porcelain veneers as well, and even do a little bit of what we call like gum contouring. So I often talk to patients about how it's not just about the teeth themselves, it's actually about how the teeth fit into your smile. So it's about the pink aesthetic, so the gums, as well as the white aesthetics, which is the teeth. So gum contouring is something that's super important. And more recently as well, I've started training in Botox treatments, but less so for anti-wrinkle treatments, more because we can actually use it to to treat gummy smiles, so to reduce the amount of gum on show, and also masseter Botox, which is basically just to sort of slim the lower face. So it's all about trying to control the smile, not just the teeth themselves, but actually like the soft tissues and the lower face, so then we can control the whole smile design.
How many hours has Olivia spent providing cosmetic smile makeovers?
So I was asked this question recently, and I actually thought I need to figure that out and figure out the maths. So I would say, I mean, each bonding case we're normally spending at least 3-4 hours. Over the space of a year, we figured that out, and that's going to be about 400 hours worth. So I've been doing it for the last maybe sort of 5-6 years, so that's Probably around 2,500 hours worth of just doing composite bonding treatment. So definitely put the hours in. People say practice makes perfect, so hopefully that's the case.
How can I get a brighter, whiter smile?
So this can be very simple. Most simple treatment is teeth whitening. It can be done in as little as 2 to 3 weeks. It's suitable for most people, so long as you've not had too much sort of restorative work within the mouth and there's no sort of negative side effects. Sometimes you can get a little bit of sensitivity, so that's usually within the first few days, but that goes away, and it's just, a really simple, easy way to brighten up the smile, and it doesn't actually require that much top-ups as well. Lots of people think that you have to do the whole round of whitening again in the future, but that's not the case. After you've finished the 2 to 3 weeks worth of the whitening, I normally say to my patients, maybe every 3 or 4 months, maybe do one night of the whitening. Often people will have like a syringe of the whitening gel left over, so they'll have enough for like the next sort of year or two. After that, you can buy just each syringe individually, and it's really easy just to maintain the brightness of the teeth.
Can cosmetic dentistry fix crooked teeth?
Yes, there's lots of different ways to straighten the teeth. Typically, in about 90% of cases, you can use clear aligners, so we use a system called Invisalign. The average amount of time that it takes to straighten the average case is normally about 9 months, 9-10 months. Sometimes it can take as much as like a year and a half. Otherwise, if we think that it's too complex, which isn't often the case, we do also offer fixed braces. There's other colleagues in the practice that offer fixed braces for the complex cases.
Are cosmetic dental procedures painful?
No. So firstly, with things like whitening, yes, you might get a little bit of sensitivity in the first few days of doing the whitening, but that always goes away after a few days. Our most common treatment is composite bonding. So we don't need to give any anaesthetic for that at all. We're not drilling down the teeth or anything. We're only adding the composite where we need to, so no pain involved with that. Sometimes if we're doing things like porcelain veneers, where we do need to do a little bit of adjustment of the enamel of the teeth, we do sometimes have to give a bit of anaesthetic. But yeah, so when we give the anaesthetic, sometimes you might feel a little pinch when we give the actual anaesthetic itself, but otherwise you'll be nice and numb, so no, you won't feel any pain.
Will my smile look natural?
Yes. So firstly, we always have a really detailed conversation with yourself in the consultation appointment. I often get you to show me pictures of other smiles that you like, different sort of cosmetic work that you like, so I've got a bit of an idea, we're both on the same page. I mean, the type of work that I tend to produce, we always make sure that we incorporate in different sort of textures within the tooth, so it's not just about, I guess, like the actual shape of each tooth, but I do the extra steps that a lot of dentists don't do in order to make the composite look as lifelike as possible. So on the tooth surface itself, it shouldn't be completely flat. There should be little sort of undulations in the surface, little natural effects. Also, the shade of your composite shouldn't all be one big block shade. So we use a layering technique, which means that we use both a dentine shade of composite, which is more opaque, and also an enamel shade, which is a bit more translucent. So it just means that everything blends into your natural teeth a lot more. And then lastly, every dentist has got a different sort of style of work. So a lot of the patients that come to see me have probably seen some of my work on social media before. They know that that's the style of work that they like. And yeah, it's a bit like if you imagine, if you were to ask like different artists to paint the same image, every image would look slightly different. So it's worth having a little look into different dentists, and my work definitely is a bit more on the natural side.
How long does treatment take?
So for the most common type of treatment, so if your teeth are already quite well aligned and we don't need to do any teeth straightening first, often you'll come in for your first consultation appointment, and the first treatment we do is the teeth whitening. So we get some scans of your teeth, 3D scans on the same day, so we can send that off, and then within about a week we can get your whitening trays back. We then get you to do 2 to 3 weeks worth of the whitening, and then we always need to leave it 2 weeks of rest as well, so no whitening, before we then book the bonding appointment. The bonding appointment, we do all the composite bonding all in the same session, so it's all done in one appointment. So from start to finish, from the consultation to you sort of leaving with your dream smile, normally be talking about sort of 5 to 6 weeks on average.
Where can I learn more about Olivia's work and patient transformations?
So if you go onto Instagram, I've got a Instagram page where there's lots of different smile transformations. You can check out lots of different types of treatment, often captions as well that explains what we've done in each treatment, so that's where you can learn more.